Welcome. Today, as you will gather and see, is all about making the most of Stoptober. Just to introduce to any of you who are new to the Public Health Communications Hub, I set this up almost 2 years ago now with some really good support from Can Digital. As a place where those of us working in public health communications can share, ideas, share good practice, share evidence of what we know works. And we've arranged several of these free webinars now where you get a chance to share, like I say, learnings. The idea is that we come together and help solve problems and things like that. So just to introduce myself briefly, I've worked in NHS communications for almost 25 years now. I currently split my time working in a part-time role in the NHS in South East London and supporting other public sector communications teams to use behavioural science and run behaviour change campaigns, which is an area that I've become a bit of a specialist in the last sort of 5 or 6 years. I'm really passionate about using behavioural science within the public sector. So that's a little bit about me. I'll ask everyone speakers to introduce themselves when they come in. Just as a little bit of an introduction, though, to the topic. We arranged this webinar as we know, many of you are now at this stage planning for Stoptober, which is not very far away now. And it is, Stoptober is a big event in the smoking cessation calendar. It's been with us now since 2012. And it is a real big kind of mass participation event where people are encouraged to take the challenge of stopping smoking for 28 days during the month, with evidence showing that if they can make it to those 28 days, then they're 5 times more likely to quit for good. So it's an important part of the smoking cessation calendar and the public health kind of communications calendar. We also know that most people use willpower alone to quit for good. We also know that most people use willpower alone for their quit attempts, even though this is this is the least effective way. So this year, the theme that's come out nationally is "Let's Quit Smoking Together." This year there are no national paid adverts planned. So it's important that we really look at the evidence and what the evidence shows works locally and try and follow that evidence, really. The Department of Health and Social Care have produced a comprehensive toolkit. This year it's really good. They've taken on board a lot of the comments that they received last year. We got the toolkit much earlier this year, which was really helpful. It includes a lot of assets that can be localized and adapted in Canva, again, which is really positive. It includes things like messaging to prepare people, tips and motivation to keep them on track. There's a range of printed materials you can order and key messages you can use. So if you haven't looked at it, I do recommend having a look at it, and I'll put the link in chat shortly. So like I said, there's a lot of really great content in there. However, we do know from previous campaigns, both smoking ones and other public health campaigns, that national toolkit doesn't work as well generally as content produced locally and content properly localized. So to make the most of Stoptober, it's important that you take the national messaging and localize it with local pictures, case studies, stories, and that kind of thing. That's what we're doing in South East London, where I work, and we will be building on our kind of existing smoking campaign. And in a moment, Simon is going to share with you some good examples of similar from South West London. But before I bring Simon in, I'd just like to share a couple of ideas that I'm going to be testing this Stoptober. And the first one, which really is aligned with the Let's Quit Together this Stoptober theme, and that is offering support to enable friends and family of smokers to help the smokers quit. So research highlights the importance of social support, and it really does highlight the importance of this in helping not only quit attempts but also sustaining smoking cessation. So there's a lot of evidence that support from friends and family can help people quit and stay quit. However, we also know that roughly 45% of people who make a serious quit attempt don't tell anybody about it. They see it as their problem that they need to deal with themselves, and they just kind of go off and do it, possibly under, because they don't want to disappoint people and because they almost expect to fail. So I see that as a real opportunity to put some support in place for the friends and family of smokers to support the smoker around Stoptober. And like I say, it fits in very nicely with the Let's Quit Together this Stoptober theme. The other area that I'm going to look at targeting people is targeting people who've recently been through significant life changes. So research again shows that changes in context and moments in people's lives, when their habits and their behaviours are disrupted, make them much more open to positive lifestyle changes. So there's a really interesting study in Oregon in the States which showed that people who recently moved into an area were 4 times more likely to take up a trial offer for a shared bicycle scheme. So it's not smoking, but it is a healthy lifestyle related, healthy travel thing. So yeah, I'm going to try and see if that can also translate to smoking. Another one that I think is really interesting is targeting people whose age ends in a 9. And again, there's a lot of research that kind of illustrates this could work. So it shows that people, 9-enders, if you like, are 48% more likely to enter a marathon for the first time than any other age. And so, like I said, we're going to play around with that this October to see whether it can have similar impacts on smoking cessation. And if anyone is interested in joining in that and sharing results so that we can see whether that is an effective tactic, please do let me know. So now I'd like to bring Simon in. So please introduce yourself, Simon, when you come in. And Simon's going to talk about how they're localising Stoptober in southwest London with case studies. Thanks, Simon.
Thank you, Russell, and great to see everybody on the call. I'm Simon Jones, and I'm the Director of Communications at Westco. Hopefully a lot of you have heard of Westco. We're a communications and marketing agency that specialise in NHS and local government communications. And as Russell has said, we've developed a campaign for Stoptober. And I'm just going to share my screen now just so I can show you a few slides from the campaign. And we developed this campaign with councils in southwest London, of which obviously Merton is one of those, but it's also 5 others. And sorry, let me just go back to my screen. I just had a thing saying my microphone's muted, but I think everyone can hear me. And so we developed this campaign with councils in southwest London, and the campaign's called Feel Free. And as the title suggests, and what I'll show, is that the campaign's all about really the kind of positivity that comes with being free from the addiction of smoking. And as you'll see, and what I'll show in the next few minutes or so, is that it's very much a peer-led campaign that uses storytelling. And what I mean by that is using real people to talk about their experiences of quitted smoking or wanting to quit smoking and what freedom means to them. So it very much has storytelling embedded in it, using local people and local images, as Russell said, that's so important. And in terms of how we actually developed the campaign and how we went about that, really, is that, so I'm just trying to move, it was very much research led. So we know, you'll know, everyone know on this call will know there's a mountain of research when it comes to smoking cessation, a huge number of national studies that look at motivations and barriers. But we wanted to get local insight from our local communities in southwest London about their own perceptions, about their own experiences of trying to quit smoking, and also about their access to local services as well. And we also wanted to use that as well, the research, to help inform the campaign design by using it to test messages and creative approaches. And we did this by holding what's called a World Cafe. Probably many of you have probably heard of World Cafes. They are very relaxed, intentionally relaxed kind of experiences where people can come together to share their own personal experiences and listen to others when it comes to stories around smoking cessation and what it means to them. And so it's very different from focus group, which tends to be perhaps more formal, a bit more kind of methodical. World Cafes are much more free flowing. It's held in a cafe. We ensure everyone obviously has access to refreshments and coffees, and it's designed really to help people relax, to help talk, to enable them to talk about their own personal experiences in a way perhaps that they wouldn't necessarily do in a focus group or other setting. And so we use this World Cafe to really get under the bonnet of people's own local experiences and what it means to them, and also what their own motivations are. We used it as well to test different ideas about the campaign design as well. And the kind of other key benefit of holding the World Cafe is that we used it as well to create campaign ambassadors and advocates, i.e. people who were willing to share their stories to others as well by becoming kind of case studies, really sharing their own experiences through video content that can help form part of our campaign. So for this World Cafe in Southwest London, we had 40 people attend. We divided into 2 sessions that focused on our 2 target audiences. One was people 18 to 35, and the second were people who were 45 and older, and they were extensively from manual or casual labour backgrounds, really, but that was our target audience as well. So the World Cafe kind of picked out sort of 5 key motivations, really, big reasons why people want to quit smoking. Financial costs or self-realization being one of the big things, family pressure or disapproval from their networks around them, that peer pressure from their social networks or family networks is another driver. Experience of other people's health issues. If you have family or friends who've got health issues linked to smoking, that has a big impact. And as Russell suggested as well, the other big driver is around life events. If someone's life has changed, whether it's a new job, coming up to that big birthday, perhaps moving home, or of course becoming a parent, those type of big life events really do spur people on, because it gives them that positive foundation to make the change they need. As well as you get older, knowledge of health risks become real. They become more tangible in terms of what the health disbenefits of smoking are. And so for older people, there is definitely a place for health messages. We found that less for younger people, but for older people, that was one of the motivations as well. And so we developed the campaign Feel Free, and the whole purpose of Feeling Free in terms of the assets we use were to turn on its head the kind of negativity, the sort of messages you get on cigarette boxes, those awful messages that turn so many people off that you're killing your unborn baby, all those awful messages that are real turn off. We turned it on those head with positive messages around what feeling free from addiction means to people. And so using as much as we can real people to illustrate that in terms of quotes about what they mean to them. And what I'm going to do now is just share with you as well some of the case study content. And these are videos. It's only 3. They're very short videos, as you'll see. Hopefully you'll be able to hear these.
I don't drive at the moment, so if I have to run for a bus, I'm out of breath. And I'm 30 years old, so it's not... Obviously, I eat bad things, etc., etc., but the smoking has such an impact. Your whole lungs, your heart, everything just doesn't work how you thought it would. And yeah, when you see people around you that don't smoke and they're living similar lifestyles to you apart from the smoking, you really understand it.
So that's Liam talking passionately about what feeling free means to him. I shall introduce to you Louise.
I'd be quitting for the kids to have more money. We can go on little holidays and also time as well. It's very time consuming. Having to go out for a cigarette and things like that. If I'm smoking 10 a day and it's 10 minutes each, that's like 100 minutes that I'm kind of spending outside away from the children, doing what I should be doing, really, to be honest.
Okay, and finally, probably my favourite, I think. He talks very knowledgeably.
Due to smoking, I believe, I suffer from COPD. I have slight heart problems, and it has certainly affected my life. I'd love to be able to go over the park and play with the grandchildren. I'd love to be able to catch them at the top of the stairs without sitting down and having a breathing attack and grabbing for an asthma pump. I tried to give up and I couldn't. That's where I am, unable to stop at this moment.
So I'll stop sharing there for a second, and this is done with Merton really using some of their campaign identity. But the point is that we all know how important using real people are when it comes to the campaign delivery. People who look like us, talk like us, that are going to be much more influential than using standard messages. So we also all know how difficult it is to get case studies as well. And so we use these events. You can do it in your own patches, in your own area, to bring people together in an informal setting to share their experiences. Obviously, we do incentivize people. So for Feel Free, we did pay £100 Amazon voucher to attend the event and also to be part of the video case studies that flowed from that as well. But the event, one of the real advantages of doing it that way as well is that by people sharing their own experiences with each other about what it means to them to quit smoking, it inspires them as well. It enables them to dig deep when it comes to what their own personal experiences are. It enables them to bring out their own kind of characteristics, I guess, or their own kind of experiences in a way that's much more vivid than just simply going straight to a case study on its own. So sharing experiences enables people to understand their own motivations much more, and you get much more compelling content as well. So if people are interested in that approach and would like to hold a small version of World Cafe in their area, then I'm very happy to come to speak to me afterwards. I'll leave my email details in the chat because I can show you how to do that and how it could work. Maybe not for Stoptober, because there is a kind of 3 to 4 week lead-in time, but certainly for the January push. Thanks, Russell.
Thanks, Simon. Really interesting case studies. I'm going to take Chair's prerogative and just ask one quick question now, actually, Simon, if that's okay. Just the people who attended your World Cafe, did they know that they were going to be filmed after it before they came?
For this particular event, they didn't know, but we did introduce it on the night. So we kind of invited people who are willing to take part to take part. We, out of the 40 people, I think around 15 expressed an interest in being part because there's an extra incentive associated with that. But how we're designing, we're about to hold an event at the moment, actually, one of the London boroughs we're working with, and we are making it clearer at the start, though, this time round, that the conversation also includes sharing experiences as well that will help inspire others as well on social media. So we're making it more clear in the next one that we're doing. It does involve that.
Yeah, I mean, it is really interesting how they've kind of gone through that thought process and then put, I can see how it would make what they say on film much more meaningful. Thank you. John Paul, would you like to introduce yourself, please, and then do your bit?
Yes, absolutely. Hello, everyone. I'm John Paul from Cannes, and we help lots of different organisations amplify their campaigns and measure them and evaluate them in real time. Russell asked me to put together some learning from the campaigns that we're running at the moment. And so I'm just going to quickly run through some common challenges, some stuff that we're finding is not working and some stuff that we're finding is working. So hopefully you can take that and apply it, yes, to maybe some of your promotion in September for Stoptober, but also for ongoing smoking cessation campaigns. And it is common, unfortunately, not just in smoking cessation, but many other public sector campaigns, for us to use channels that deep down in our hearts we know don't really do anything, don't really drive response, and then do a little bit of the stuff that works. And I think one of the most valuable things we can do as communicators is ensure that our organisations end up investing most of their budget in stuff that works. And so I wanted to start very quickly with some principles that we apply to all the campaigns that we support. You've got to make sure that you're not accelerating inequalities by poor choice of channels. There are many campaigns where there is no proof that the target audience has been reached and reached multiple times. It's very important to get that right. Making sure, for example, with lower income households, manual workers, people like that, how can you prove you've actually reached them all? Because that is a huge barrier to quitting smoking, is not realizing that there's even some support there. And we also believe there must be a mixture of not just digital, but physical and human intervention points, stop smoking services, access to services in pharmacies, but also that storytelling element. Stories resonate with people in a way that maybe stats and generic ads don't. And that has the impact of simplifying things and making everything much more accessible. Also, despite a good and welcome injection of funds into smoking cessation, we never have enough to do the job as well as we'd like. So we've got to be super focused on reducing cost per quit attempt and getting that down as low as possible, because that means that we get more quit attempts for the budget. It also means that we can sustain campaigns throughout the year. Whilst there are these brilliant events that happen in the calendar, smoking cessation needs constant nudging, constant pushing to do that. And so in order to do the two at the top, you always have to make sure that everything is measured, or to put it another way, if you can't measure it, don't do it. And that's making sure we've reached everyone, looking at the cost per person reached and cost per interaction, and then the cost per quality quit attempt. And if you don't know those things and you're not able to measure those things, you really can't do the job. So these are the principles that we stick to and won't really negotiate on. One key point that's absolutely essential is to make sure that you have a really simple, accessible user experience and landing page, and that you can measure that in real time and also feedback data from interaction with that landing page to the platforms that you're buying media on. And so having a graph where you see campaign interactions against quit attempts is an essential part of the job. If you can't see that if you can't see that graph, you can't do the job and you can't optimize. So, I mean, if you take away one thing, making sure that these things are there and integrated is a core foundational element of a successful campaign, and a campaign that will drive cost per quality quit attempt. When we've been measuring channels for a very long time, yes, with smoking cessation, but also with other campaigns. And in terms of paid digital, we find that these channels, for a range of reasons, have really high cost per quit attempt, or to put it another way, don't really work that well. So you can take this from, we can show you the data that backs this up, but it makes a lot of sense to avoid these channels. Same goes for radio, TV, things like that. It's not that they don't work, it's just that the cost per outcome is so high that you could achieve many more quit attempts by investing in other channels. Also, relying on organic social media to do your amplification is about the same as doing a press release or doing very little indeed. You certainly won't be reaching the audiences that you want to get in front of. What does work well, that you could probably replace organic social media with, is using your owned estate, the council owned estate. So as Russell was alluding to, targeting people on pay your council tax pages, potentially as they're moving house or setting up a new council tax account, is a really neat way of advertising to them in that moment, but also then remarketing to them afterwards. Use of your e-newsletters, use of your owned out of home. This is low cost, sustainable and targeted. So use this as much as you can. That mentioned that point around when people move house, but there are also people registering births and getting married and so on. These are key life events that councils have this brilliant source of data. So again, advertise there, remarket to those places. Absolutely essential in all our campaigns is search. Putting ads next to search results on Google and Bing around these sorts of terms works incredibly well. And we see that whilst 15%, we might allocate 15-20% of the budget. The quality of quit attempts that comes from search is the highest. So this will do most of the heavy lifting and most of the quality for you. Where you have digitally unengaged audiences, augmenting campaigns with digital dip zone targeted direct mail is the best way to get over the sort of digital divide or target the grudgingly digital. But you must have a non-digital call to action on that, so a phone number or going to a pharmacy or something like that. And then in terms of targeting the audiences that we need to reach, I mentioned search, but there's also advertising on news, national news ads at national newspaper sites targeted to your specific geo to reach manual labourers, lower income households and so on. For younger audiences, Snapchat is the way to go. So, but that what you end up with really is a marketing mix for smoking cessation, which is that owned estate targeting those specific life points, targeted direct mail to specific audiences, and paid digital. So on Snapchat and Meta, for example, you can target just 29, 39 and 49-year-olds in your area. You can remarket obviously as well to those key pages. So just to in summary, very, very quickly, things you can stop or move away from, complex landing pages without audience tech in, and a lot of the kind of above the line unmeasurable broadcast, and maybe don't ask your comms team for organic because they might do it and it's kind of a waste of time, and also making sure that we don't include smoking triggers in any of the messaging. And what it would be good to build more of and replace those tactics with is really accessible landing pages, story motivation driven messaging that you can then measure, remarketing to all of those life stages, use of search, making sure you're actually reaching 100% of the target audience and zooming in on those key life stages, and then evaluating in real time and optimizing in real time so that your campaign's cost per quit attempt will go down as you leave it on, yes, into Stoptober, but beyond into November, December, January and so on, and that's really key to success. We also think, and this is just a last sort of point, that this positive health intent around smoking can connect beautifully with know your numbers, with NHS health checks, with physical activity campaigns. And there is also potential for collaboration this winter with cost of living, with pharmacy first campaigns, demand management, also the connect to work well and widening inclusion campaigns, because that positive health intent can also be connected to lots of things that will make life better for them. So yeah, that's what I put together for you, Russell. Hopefully some useful bits in there.
Thanks, John Paul. Some really interesting bits in there. I'm just wondering, are there any questions? I haven't seen any in chat. A few comments, but I haven't seen any particular questions.
Russell,
yes,
it's Wendy. Hi, I've got a quick question. Is that all right?
Of course it is.
Yeah. Hi everyone. I'm Wendy from Royal Borough of Greenwich. Obviously, that was really, really helpful. I was just thinking all of that was really focusing on the smoker themselves and targeting them. One thing I'm interested in is anyone been thinking about how we could directly market with the same kind of techniques to the people that we want to refer, so health professionals and frontline staff and social care, because I'm thinking we need them to be bringing it up with the smokers as well and where they're interacting with them. So I was thinking, where do they look for information? Where are they getting their training, or where are they searching? And could we apply some of those same techniques to directly market to health professionals so they are bringing it up with smokers about where to refer and how they can get support? So it's just if people have tried that or any thoughts on that, really, so we could directly market to them to encourage them to have those conversations with the smokers. So we're doing it both ways, asking the smoker to self-refer, but the other way as well, we really need people to be where they're interacting with services. How do we get them to make sure they're talking about smoking as well? So thanks.
John Paul, I can see you nodding. Have you got some thoughts on this one?
I have some thoughts. It's not easy. Your strongest channel will be internal comms. I mean, often in councils, you employ a lot of these people. There are ways of targeting social workers online by advertising next to terms that kind of only they would search for. But your best route is, I mean, you employ these people, and so you creating something that works for them. And I think social workers particularly need everything framed in a sort of conversational way, and for their judgment to be used about when to intervene and when that might work. Social workers are brilliant at understanding how to land things with people. So I think giving them resources and co-creating with them is probably a really, really brilliant way to go. I think there's a lot of room for improvement in that space, Wendy.
Yeah, definitely.
So yeah.
That's why I brought it up. I was thinking it's something that would be good to look at together, wouldn't it? You know, thinking about ways in which we could co-create messages. Yeah, thanks.
100%. And the friends or family members side of things, Russell, I mean, you've done some good work on this, but, you know, putting in the messaging on social media, are you a friend or family member of someone that smokes, and then encouraging them to engage, I think is another really super tactic.
Absolutely. I can see this question from Louise about suggesting any helpful resources. So I do have some resources. I haven't got them like direct in my hand at the moment, but what we'll do is when we do the follow-up email, I'll include some links or some resources, for that, which you'll all get. I can see another question from Michael. Are John Paul's recommendations based on a campaign in an urban location? Does he think the same tactics apply to rural localities?
Yeah, great question, Michael. We do see variances in campaign performance, urban to rural, but normally the big variances are around things like recruitment due to transport and availability of jobs and things like that. In terms of search, remarketing, targeting these life stages and so on, a lot of that digital stuff will work. Direct mail can be trickier in rural areas, and also exposure potentially to out of home and things like that can be problematic. But search definitely works. Social will work. News will work in almost all circumstances. But yes, there are variances in performance, and to be honest, we don't know why all of those happen. The further north you go, for example, Snapchat is just incredibly powerful, and they and we don't really know the answer behind it. But that's why constant testing and evaluation and stopping doing things that don't work and increasing investment in the things that do work is essential.
I was just going to say, actually, sorry to jump in, but what I was struck with was you're not recommending like radio and things like that, recommending outdoor. But for me in Cornwall, with that rurality, as you said, outdoor can be quite tricky.
It's
radio kind of fills that gap because it's kind of a broader, it's that balance, isn't it, depending on where you're actually where you're running your campaigns, I suppose.
Absolutely. With radio, though, you've got to be quite hard-nosed. Like, what proportion of our target audience is listening to that station every day or at least once a week, and can they prove that? If not, it's tricky to make the business case for investing in it. There are brilliant local radio stations, and I think sort of PR, comms, content partnerships with radio stations can work well, but the penetration within target audience sometimes isn't that high. Also, when we've bought it digitally using DAX and things like that, the cost per thousand is about £17, which if you spend that on Meta or YouTube, it's £3. So that radio ad really needs to blow everything out the water to beat what you can do on other channels. And then we find when we measure radio, we don't actually see large increases in search traffic or traffic to the site, i.e. the outcomes being taken. So that the way we said that, we're not saying that they don't work, but it's just that the cost per outcome is so high that even if you start doing them, as you optimize, you'll reduce investment in them over time.
That's really interesting.
Thank you. You need to know your local audience and where they're listening, which is where those sort of cafes, understanding media consumption and using existing data is absolutely core.
Thanks.
I'm just going to put a slide up, which I've just quickly put together, which is just some of the key takeaways from today. So I think, start promoting it soon, plan now, promote from the middle of September. Often we start too late with Stoptober. Don't do that. Make sure everything you do is measurable, as John Paul was just saying. Choose your channels well. Don't choose them based on vanity or because so and so likes seeing it here, or because that's what you usually do. Choose the channels that evidence shows work. Localize the national messaging. Draw on local and national insight. There will be local nuances, the work that Simon drew on, that there will have been things in there that wouldn't have necessarily come out from national insight. Try and use positive gain-framed messages, focus on some of the short-term gains to the smoker for stopping. Make use of the channels you own. Organic posts have such little impact nowadays. Where can you put ads on your council's estate for no cost or virtually no cost? If you can identify some budget, run some paid for targeted ads. It will make such a difference to your impact. Encourage the friends and family to support and provide some support for them. Encourage smokers to support each other. Think about targeting people around those key life changes. We've suggested a few different ways today we might be able to do that. And this one I think is really key. What we tend to do a lot with public health campaigns is we get little bits of money, pockets of money during the year, and we have a big burst of activity around, something like Stoptober, where we might run ads for 4 weeks or something like that. But that's not enough. The smoker is, well, people need to see ads several times before they act on them, and a lot of your smokers, October won't be the right time for them. They might show a bit of interest, but they may even try a quit attempt, but they may fail. But what you need to do is use Stoptober as an opportunity to build your audience for the rest of the year. So in South East London, we've had some big bursts of activity around different events. And what we're doing now is we've got a low cost, always on bit of activity where we're retargeting the people who've clicked on our ads previously. So that, and Stoptober will build an audience that we can use for the rest of the year, really. So if we stopped at Stoptober, we wouldn't see the full impact of that. And one that John Paul alluded to, which is really, really important, use simple landing pages. Don't give people too many choices. If you give people too many choices, they won't take any of them. So yeah, that's the end of today. We will share the slides. I'd like to say a big thank you to Simon from Westco and to John Paul from Can Digital. And yeah, thank you, and we'll see you again at the next one.